Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Today we'll talk about non-COVID-19 deaths among people with diabetes spiked during pandemic. Non-COVID-19 related deaths among people with diabetes increased during the pandemic, as did the diabetes complication of sight loss, according to the global study review led by the University of Massachusetts Amherst public health researchers that examined the impacts of pandemic-related disruptions on this vulnerable population. The review, commissioned by the World Health Organization and published January 23 in the Lancet Diabetes and Endocrinology, looked at the 138 studies compared pre-pandemic to during pandemic periods in North America, that is 39, West Europe 39, Asia 17, East Europe 14, South America 4, Egypt 1, Australia 1, and multiple regions 33. What we found overall was a fairly negative impact on diabetes outcome, says co-lead author Jamie Hartmann-Boyce, an assistant professor of health policy and promotion in the UMass Amherst School of Public Health and Health Sciences.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
The review also found a starting increase in diabetes-related admissions to pediatric ICUs, as well as a rise in cases of diabetic ketoacidosis among children and adolescents. Some of the cases were due to new-onset diabetes, meaning DKA, a serious potentially life-threatening complications of diabetes, coincided with a diabetes diagnosis. There was no rise in the frequency or severity of DKA among adults. In addition to an increase in deaths, the data on pediatric ICU admission and pediatric diabetes ketoacidosis is probably the most striking thing that comes out of this review, Hartmann-Boyce says. It was very consistent across countries, but the pediatric ICU admission is a major event for kids and their families. We know that not getting your eyes screened regularly if you have diabetes is a problem and leads to more sight loss, Hartmann-Boyce says. And we saw diabetes-related mortality and all-cause mortality increasing in England during the first wave that wasn't attributed to COVID, but was probably related to reduced access to healthcare and reduced healthcare utilization. The researchers note that there were more new cases of type 1 diabetes than would have been expected, and children newly diagnosed with type 1 diabetes were much sicker than during non-pandemic periods. Much less common than type 2 diabetes, type 1 diabetes is an autoimmune disease that is usually diagnosed in childhood but can occur at any age. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.